If you don't know who we are, my name's Lauren. I'm a physical therapist downstairs in rehab, and this is Lori. She's a PTA. A couple of years ago, we got a grant at the medical center from the Susan G. Komen Foundation to send people to be certified to treat lymphedema so that we can better serve individuals in the community that have had breast cancer surgery, and through that, we found that there's so many other ways that we can use the treatment. So that's sort of why we're here. But March is Lymphedema Awareness Month, so that's why we're doing these sessions today. And I'm going to talk a lot about the physiology of the lymphatic system. So if you have questions as we go, let me know. It can be confusing, but to understand lymphedema, you kind of have to know where it comes from. So we're going to talk a little bit about that. So we'll also talk about the treatment and management as well. So the lymphatic system is what's going to carry the lymph around in our body. So the functions of the lymphatic system are going to prevent edema by returning the protein and fluid that comes out of our circulation. So you'll see in a little bit that our circulation is a circular system, and the fluid that comes out isn't able to put proteins back in our blood very well. So our lymphatic system returns that so that it can be filtered out of our body. And it's also, in doing that, going to absorb some of the fat and the fat-soluble vitamins that are in our small intestine, and then provide immune surveillance as well. So any microbes and bacteria and cancer cells and all of the things that are floating around are going to be filtered out. And that happens in our lymph nodes, and our lymphatic fluid is going to carry those things to the lymph nodes and then to eventually be filtered out. So as you can imagine, whenever this lymphatic system is disrupted in any way, then we'll be more prone to get infections and we'll be more prone to have edema. And the lymph fluid that's going to carry these proteins is, predominantly protein, but also water, different cells. It's going to carry our red blood cells and our white blood cells, waste products, and our fat from our intestines. So then about 90% of the fluid that comes out in that capillary bed, which you see here, you have the artery and the vein. This is that circular system, and it ends here to take fluid and proteins to your tissues, and it's going to filter out, but the proteins can't get back in. So the proteins are going to go through our lymphatic system, which is green in this picture. And about 90% of the fluid that's going to come out here to nourish our tissues goes back in. That extra 10% that doesn't go back in is what's going to come through here. So whenever you have lymphedema, all this fluid is building up and coming out, and it's not getting filtered back in because there's so much backup, and that's how we end up with edema. So we'll talk a little bit, I repeat myself several times as we go about this, how edema happens, but it's important to understand how it happens to manage it. And that fluid ultimately is getting back to the heart. And as you can see, it runs fairly parallel, but it is a separate system. So here's that capillary that we just saw on the other picture, and it's going to flow through the lymph nodes, and then it's eventually getting dumped back into our veins, and then it's going to go back to the heart. So it's not one system, but it joins together very, very closely. And all of those things are getting filtered through our lymph nodes. And the lymph nodes are going to filter out the bacteria and toxins and dead cells. It's storing our white blood cells, which are going to fight infections. And then it's going to regulate the proteins that we're transporting. If there's too much protein, it's going to add more water so that it flows better. So as you can imagine, again, if you have removal of lymph nodes in any area of your body, that fluid's not getting filtered as efficiently. So then that's going to slow the process. It's going to cause fluid backup. And I mentioned in our last session, you can see here, if you have an infection somewhere in your body, those lymph nodes are going to be enlarged because there's more activity. But if you're not feeling sick and you're feeling around here, you might, if you're sick, you have an infection or something, you'll feel that they're swollen. If you feel swollen lymph nodes and you're not sick, that's not normal. So that's something that you should talk to your doctor about, because it's not normal to feel swollen lymph nodes in other areas of your body. Or if you're feeling your neck and only one side is swollen and you're not sick, then that's an important time to talk to your doctor as well. So another good reference to just keep in your mind later is sort of how close the lymph is to our skin and our muscles. So it's going to be our skin, the lymph vessels and our other vessels that are running with it, and then our muscles. So it's in between our muscles and our skin. So whenever we're doing the lymphatic massage, it's important that it's very light and rhythmical, because you don't want to compress them. If you're pushing hard and doing a deep tissue massage, it's not going to go anywhere. So a lot of people, I think, oh, I'm going to go to PT and get a massage today, but it's not the same. It's still relaxing and it feels wonderful, but it's not the same. And there's a reason. And this talks a little bit about the lymph transport, how it's going from the tissues to the lymph nodes to get filtered. It's going to go out in the capillaries, and then these are lymphangions, and that's the only spot that it's contracting. It's not contracting like our heart pushes our blood flow through with the heartbeat. It's not like that. It's only going to contract 6 to 10 times a minute. So that, compared to our heart beating 80 times a minute, our heart beats a lot compared to the lymphatic system. So it just kind of shows how slow it is and how important it is to keep moving, because the muscles are so close that they're going to be a driving force as well. So the more that you move, the easier that's going to flow, because it relies heavily on other things. And again, if you get edema back up and those lymphangions expand because there's so much fluid, then they're not going to contract as efficiently. It's going to slow it down even more. This is sort of repeating what I just said about the elasticity. Just if you lose the elasticity in the skin and in the lymphangion, then it's going to not contract as heavily and it'll need help. And this is just a quick review of the difference between the two. They're similar but different. So your lymphatic system is one-way street. Your blood is a circle. 2 to 4 liters per day is transported through the lymphatic system, as opposed to 5 to 6 liters every minute in your heart. So that, again, it's a slow system, and that's just going to back up even quicker whenever it's delayed. Intrinsic contraction of that lymphangion as opposed to being pumped by the heart, and the lymph nodes are going to be the filter. So then how is this swelling going to occur? I'm going to go right to the picture and explain it. So our lymphatic system has a capacity, obviously, so that transport capacity, but our lymphatic load is way down here. So this is our normal. 2 to 4 liters per day is our normal. It's not anywhere close to the capacity. There's about 30% more fluid in here that we can back up before we actually see a difference. But if we have surgery, if we have a big scar, lymph nodes removed, something, this capacity is going to go down. So then there's not much wiggle room here. So as soon as that lymphatic load, even if it's normal, gets past that transport capacity, then you're going to have swelling. So that's where lymphedema comes in. The transport capacity is affected because of surgery, and the lymphatic load stays the same, but you're going to have swelling because you don't have the ability to transport it as efficiently. Then comes other reasons for swelling that can eventually end up being lymphedema. If the transport capacity stays the same, you don't have lymph nodes removed, but the lymphatic load increases because you had a total knee replacement and you have healing going on and all of this swelling. You have swelling for a while and you're still above your capacity, but that swelling goes away whenever you heal, and then everything goes back to normal. So that's how you know the difference between the two. There's differences in the kind of swelling. Swelling from surgery is made up of less protein and more water, but you're still having that swelling that eventually goes away. If you have that swelling because, say, you have venous insufficiency, the blood isn't getting back to your heart as efficiently, then over time, you're still going to have that load increase, but over time, the capacity is going down as well. So it's like you kind of have a shift, and over time, it's turning into lymphedema because the longer that you have that load, the tissues are changing because they're not getting nourished as well. So the picture helps, but it's still confusing. And again, this is just sort of a repeat. The lymphedema is a change in the transport capacity because of surgery from cancers or lots of different things. Some people are born with impaired lymphatic system, so that's called primary. We didn't get into that a whole lot. And then edema from surgeries and other injuries. So then the signs of lymphedema, typically you'll feel a heaviness or a weakness in your limb before you see that swelling. Like I said, you have a 30% increase in capacity before you start to see swelling, but you can feel it before you see it. So that's important to know. It's going to be a gradual, progressive increase in size. Usually if you have swelling and you push on that area, your fingerprint's going to stay. But again, the longer you have that swelling and your skin is changing, you might not see that anymore. It's just like it gets to an amount of hard skin feeling that you no longer get that. It's usually not painful. It can be discomfort. It can be explained as discomfort. And again, you'll have those changes over time. And then you'll have different stages. So this stage 0, you might have lymphedema, you just don't know it yet. You're starting to get that heavy feeling. Stage 1 is you have a little bit, but it's reversible. If you elevate your legs, or you're laying flat in bed, or you elevate your arm, it's gonna go down and almost look back to normal. But then it happens again. So then you know you have that lymphedema. Stage 2 is more, you have that swelling, but it's not going away if you elevate or if you lay flat. And then stage 3 is where you have massive amounts of swelling and your skin is really changing. And here's a better sort of visual. And it even goes, this stage 4 picture is mild. It's going way beyond that, but it's still a good reference. And you going to talk a little bit? Okay. Lori's going to talk more about the treatment.
So the treatment plan we call complete decongestive therapy, and it consists of like the different things we'll discuss. It's kind of our gold standard that we go by. So the treatment components would be the lymphatic massage, and what we focus on there, she kind of mentioned a little bit about it. We're going to push the unhealthy lymph fluid to healthy areas of the body. So if you are missing lymph nodes in your armpit, they're not going to grow back, and so we have to push that fluid elsewhere to try and manage it. So the compression bandaging we typically do is short stretch bandage. I'm sure you've heard everybody talk about ACE wraps. Well, this is not quite the same. We have an example here. It's a little more elastic. ACE wraps would be more for like sports injuries or something like that. Then we also use what's called foam, and that we would put like a piece of gauze stockinette on the skin. We would cut the foam to fit whatever arm, leg that we're going to wrap, and then we would put this over that. I'll pass that around and you can have this. There are different thicknesses of the foam. We would incorporate exercises into the plan too, where we work on range of motion, just moving your joint through its availability, and also working on stretching, because sometimes as people have scars, their tissue becomes hardened, and then that affects how they can move whatever joint we're talking about. We are meticulous about the skincare. It's very important. You want to avoid infection. Once you have an infection, that sets everything back. It complicates a lot of different aspects in the care. You want to also keep your skin dry and apply moisture. Lots of times people that have these issues have very dry skin, so we encourage washing, drying thoroughly, and then applying the moisture products. Education and home management. There are systems that we can get, sometimes insurance covers, sometimes they don't, but for managing, the whole goal is that we can wrap and we can get them to a manageable level, but then the patients need to take that and take it home and manage themselves. There are different garments that they can get, and we teach them like self-massaging too for that. The principles of like our massage, again, Lauren had mentioned about the light pressure, and there are different motions that we use, circular, and different, we start at the neck, and it's kind of like a whole body thing. It's not just, you think you're gonna get your arm massaged if that's where your area of problem is. You're gonna push the fluid to the healthier areas, and in the abdominal area is also important that we focus on. It's rhythmic directional skin stretching. Then we mimic the contraction of the lymphangion that she had mentioned to promote the flow of the fluid. Indications why you might have the MLD: because of lymphedema, post-trauma or post-surgery edema, fibromyalgia, chronic fatigue syndrome, rheumatoid arthritis, scleroderma, or complex regional pain syndrome. So like I kind of mentioned before, say the problem lies here in the axillary area in the right arm is swollen, and we would, with our manual techniques, we would push the fluid over to the healthy side, the opposite axillary area, and we would also push it down to the lower extremity and incorporate the abdominal area into it. If sometimes people have swelling in both legs, and so you wouldn't want to push it across because those lymph nodes are affected too, so what we would do would be push up into the axillary areas and into the abdominal area. The short stretch band, sorry, okay. Compression, are we good? Yeah, okay, the short stretch bandages, as I mentioned, are what we use, and you would always want to extend over the joint. So, for instance, you wouldn't, if your problem was in your ankle, you wouldn't want to wrap just to here. You want to push it proximally or back to the center of your body, because it's going to, the fluid's going to like spill out over the top of the bandages, and it would not be effective. And you would use, like I said, we mentioned, we use cotton padding, we use stockinette. We don't always use the foam, but lots of times that's the most effective way to help get rid of the fluid. Indications why we might bandage would be lymphedema, chronic vein insufficiency, or sometimes people have vein issues and they have also lymphatic lymphedema. It depends on like the comorbidities of what's going on with them. Lymphedema, which is fatty deposits, and usually that's in the legs that you see that. The post-trauma surgery edema, acute, yes please. Okay, class 4, and that's where there's severe swelling. As we mentioned, the compression, most of the compression garments that people can afford are off the shelf that we would like take a standard measurement, you would go and you would buy it, you know, at a pharmacy or wherever. They're more affordable. Insurances lots of times will not pay for the garments, so that kind of prevents like an obstacle for the patients. The custom flat knit are the ideal ones, and they allow for the garment to be fitted to the patient with their exact measurements. This is like when she talked about the tissues being hardened and things like that. This actually is for something like that, and it's a night splint, like what you would wear at night. I'll pass that around. And here's a sample of the theory behind the exercise is that you really want to restore the range of motion to the area and get the full joint range of motion. And we mentioned the deep breathing. Deep breathing is very important with the whole process. With the exercise, you're forcing the muscles to contract against, like when it's wrapped against the non-moving pressure of the bandages, which allows more flow and will help decrease the limb size overall. The home maintenance, I talked about the self-massaging. We instruct in the self MLD, and we do the bandaging or eventually set them up with a garment, proper garment for their issue. And we give them a home exercise program that they can do on their own. Mostly with the skincare, though, 70% of your skin infections are caused by cuts, bites, or burns. We also emphasize the foot nail prevention and avoiding getting the open wounds or the stasis ulcers. Contraindications, like why you would not want to have this done. Decompensated CHF, meaning poorly managed congestive heart failure. If you have an acute DVT, I think I mentioned before, that's not been properly treated, and if you're not on any type of anticoagulation meds, or if we suspect that they have a DVT, we would not do any type of therapy. We would refer them to their doctor. Acute cellulitis, where we've had some people that have came in and their skin is really irritated, showing signs of infections, and we refer them to their doctor. So they would need to be medicated for a couple days before we would resume treatment. Arterial insufficiency, meaning the ABI, ankle brachial index, would 0.5 to 0.8 would be caution, and you would need a specialist clearance to do any type of treatment. Here's some pictures of the before and after, like before having MLD in the treatment. Sometimes when she had mentioned about people that are born with conditions that lead to lymphedema, they might not have any symptoms until they're in their 30s or 40s, and then they start having this swelling, and then it becomes a real life-altering problem for them.
And I didn't mention it in the last session, but it's important, like, when someone comes in, it's really more of like a whole picture and what's important to them, because it's important that they're gonna be compliant with all of these things. So if you throw all of these things at somebody and they don't know how to do it, or they can't do it themselves, then we have to find something that's gonna help them manage, or they're just gonna be back again with an infection or something because they aren't doing it. So there are so many other options, like for compression and pumps and tons of different things that can help people maintain, and but it's been really good as far as quality of life and helping people get to a place where they can manage their symptoms on their own and
The
get
emotional
back to
aspect,
normal. Yeah.
too. They feel better, they feel more productive when they're able to get out and be more independent in the community, because some of these things can really be life-altering where they really can't care for themselves. Any questions? Yes.
Do you have a for someone